And welcome back to Wandering Through Wayne's World. You know, we live in Florida, and I don't know any day that I come to work and I don't see a car accident or somebody complaining about their back. Go to any 55-year-old at development and go to the pool, and you'll hear all kinds of things and all kinds of medication, but they're almost all talking about their back. With me is Dr. Brian Moriarty from Loving Chiropractic of Stuart.
Exactly.
Wow.
Thanks for having me, Wayne.
Oh, no problem. All right, chiropractic. Why? Why'd you pick that?
Well, my dad was a chiropractor, and when he was 18 years old, he was diagnosed with Crohn's disease. Now, this was back in the 1950s, and when you got Crohn's disease in the 1950s, they didn't have a lot of treatment for that. So what they started doing was they started removing parts of his intestine. They take a couple feet out, wouldn't get better. Take another couple feet out, wouldn't get better. Finally, they said he had 6 months to live. On the advice of a friend of his, he went to the chiropractor to try to treat his Crohn's disease. The chiropractor was not close. He had to ride the train hours on end, 3 times a week for 6 months to get treatment. But instead of being dead in 6 months, the treatment worked. And he lived for another 30 years after that.
Wow.
And in that time, he had 3 kids, me being the middle child. And so I always say that I'm alive today because of chiropractic care.
So you have two siblings?
Yes.
Are they in the medical industry?
My younger brother is. He's in chiropractic school right now, training to be one as well.
Okay. You know, it's funny. I hear so many people, and they go to the path of their parents. And then you get to people like me, who's the rebel, who went a totally different path. But when it comes to chiropractic, it really is the answer to the way the body functions.
Absolutely. So my father became a chiropractor because of this, because it saved his life. And it's all about the communication in the body. When the spine is out of alignment or has subluxations in it, it doesn't transmit to the brain properly, and it doesn't work well. So that word subluxation, sub means less than 100%, lux means light or life, and ation means the condition of. So it's the condition of less than 100% light or life in the body. So when your body is subluxated, it doesn't work well. So people get all kinds of symptoms. You know the traditional ones in Florida, because we get a lot of car accidents down here. You get back pain and neck pain and headaches and things like that. But we get patients with a lot of different things, like patients that can't get pregnant, kids with seizures, moms with breech babies, countless other symptoms, ear infections in kids that you wouldn't think of because it's not a pain-driven thing, but it's just their body not working at its optimum potential. And that's where chiropractic comes in, because we find the subluxated vertebrae, make an adjustment, and restore the body to its optimum potential so that I can work properly.
Okay, so the spine carries everything through it, is that correct?
Yes.
Okay, and all they're nerves, and those nerves they're the highway to the brain, is that correct?
Exactly.
Okay, so if you're driving on a highway and you're on a 2-lane highway and there's someone in this lane, in the right lane, and then 30 feet of someone in the left lane, you're going to be going like this. If the path is straight, you're going to get there in a shorter period of time, much clearer.
Exactly.
Is that the scenario between chiropractic and the spine?
Exactly. So when these bones are subluxated, there's interruptions in the nervous system. The nervous system is the first thing created in the developing fetus. When that baby starts out, the first thing created is that brain and spinal cord, and that everything in the body, your arms, your legs, your liver, your heart, your kidneys, everything is created from that brain and spinal cord. So when there's interruptions or subluxations in the spine on that pathway, the body doesn't work properly. So that's what we do, is we restore that body back so that that highway you spoke of is that straight path, easy connection. The body's a self-healing organism. Like if you cut your hand, it will heal. You don't need anything.
Right.
But just sometimes things get in the way, and that's those subluxations we talked about that interrupt that healing so that the body can't work properly.
And you know, Doc, it's funny because my belief was the body is meant to heal itself. Sometimes we need a kickstart. Okay, and I was just talking about being on my deathbed. Well, I needed a kickstart, and as soon as my body was kickstarted into gear, I got off my medication because my body is meant to work the way it's supposed to work. Your dad was a prime example. Okay, he was in a position where his body was not functioning the way it should. Okay, he got that kickstart, and his body kicked into gear. Is there an age limit for people to have chiropractic work done to them?
No, there's no age limit. I take care of a lot of newborns and pregnant moms in our practice. We specialize in that. Because of that, we'll go to births and we'll adjust babies as little as a couple minutes or hours old, because the birthing process is very traumatic on a baby. When they go through the birth canal, they don't have any neck muscles to support it. So the body's head is like a bobblehead. It just kind of shakes around. And when that baby comes out, when you're pulling or pushing, depending on how rough the birth is, that leads to the first subluxation, or the first bone that's out of place. And usually that's in the upper cervical spine at the atlas bone. And the atlas bone is key because there's over 850 million nerve fibers that pass through there. Every part of the body passes through that junction in the atlas bone. And if that bone is subluxated or out of place, the body doesn't work properly from birth. It doesn't develop properly. So we see kids with ear infections. We see kids with seizures. We see a lack of ability to thrive, a lack of ability to grow. They don't breastfeed properly. And all these things that we can do by adjusting that upper cervical spine can give this baby new life. So we see babies from a few minutes old, and we have some patients in our 90s too, and everywhere in between. I was first adjusted when I was just 15 minutes old.
Wow.
So my dad was at my birth, and as soon as I came out, I got checked, because you want to make sure that that baby's growing up clear.
How does one decipher in normal life, like, all right, I'm living a normal life, I'm feeling good. How does one decipher that I need to see a chiropractor? Like, when should someone say, hey, I need to go?
The nervous system has two parts of it: function and feeling. So function is how the body works, like your heart pumps blood without you knowing or feeling anything. Your stomach digests foods, your lungs breathe. A lot of these are involuntary processes. That's one part. And then we have a feeling part of the nervous system, which is like I pinch you and it says, ow, it's pain, or my back hurts. The function part of it is 90% of the nervous system. The feeling part of it, just 10%. So people often focus on that small part of it, that
right.
feeling part of it, like, ow, it hurts. But there's a whole other 90% of it where it's, I don't know, I don't feel any pain, but you don't know what's going on inside your body. You could be dying inside and not know it. Like, a lot of people who have cancer don't have pain because they don't feel it. So people should be checked for these subluxations, whether they feel pain or not. And then if there is something out of place, make that correction so that the body can heal itself.
Okay, so I come to your office, I make an appointment, I come to your office. What's the first thing that you do?
So first, you're greeted by our wonderful staff.
Okay.
And we fill out some paperwork so that we can figure out, take a history and see what's going on, see what challenges you have in your life. Then we do a thorough examination that may or may not include x-rays. We make sure that we check the body out to see how it's working, if it's functioning properly, if we find any subluxations. And through this whole process, if we find it, we do an adjustment. After that adjustment, the body can heal itself and hopefully help a lot of those challenges that we find.
So, and we're running out of time, but I wanted to get this point out. People, I believe, see chiropractors like they see a psychologist, meaning that I'm going to come to the chiropractor and that's it. Once I start, I got to go the rest of my life. Not so. You can heal.
Exactly. And it's not about just coming for the rest of your life. You want to come when there's a bone out of place or there's a problem. But everybody should be checked in this world to see if there's a problem, because you don't know what's happening inside of your body.
How often should you be checked?
It all depends on the condition. So with me in my practice, I get checked. I get adjusted regularly. We see over 500 patients a week, which is very strenuous on my body. So I get checked every week. But I have some people that come once a month, or maybe they come every couple months. So it kind of depends on what challenges you're going through in your body. But everybody should at least be checked to see if there's a problem.
Okay. If you can give someone one tip on how to keep your body in alignment, what would it be?
Ooh, one tip on how to keep your body in alignment.
One tip of how to keep your body from going out of alignment is don't get into a car accident.
That would be, yes. Try to avoid the stresses in life that are out there, because stresses are everywhere. You know, you sleep wrong, you knock yourself out of alignment. You have a lot of stress, you're in a car accident, major life traumas. But it's hard to say the one thing, because we can't just live in a bubble and never experience life.
That's true.
Experience life, and you have your chiropractor there, just like you have a dentist there to check your teeth, just like you get an oil change in your car to see if, to make sure that the car is running properly. A chiropractor is there to make sure your body is running properly in life.
You know, the doc deals with a lot of patients, obviously, you heard. And, I mean, it only makes sense to know that if there's a kink in your neck or a kink in a pipe, okay, if you ever take a hose and bend it, the water doesn't flow properly. It doesn't get to where it's going in the smooth path it's supposed to take. Guys, check out Dr. Brian Moriarty, Loving Chiropractic of Stuart.
Exactly.
And you know what? It doesn't hurt to get yourself in great shape. As you heard, a lot of it is not about you're hurting. You could be perfectly fine outside, and inside things are not working right. Doc, I want to thank you for coming on.
Thank you so much, Wayne. Appreciate it.
Everybody, stay tuned. We'll be right back.